We enrolled 32 patients. We saw that about 16% of those patients had that pre-specified response, meaning a minimum minor response by end of cycle 2 or a partial response by end of cycle 4. So 16 of those patients out of the 32 did not meet that criteria and had the dexamethasone added. 4 patients had dexamethasone added for disease progression. So overall, out of the 32 patients, 20 patients had a combination of dexamethasone and MLN. And if you look at the entire study, 34% of the patients actually had a partial response or better with this approach of MLN alone, and if it doesn't work well, adding dexamethasone to it. And about half of the patients actually had a minor response or better. So I think we are very encouraged by the response rate. It is what we would have expected from a relatively Velcade naive patient population getting Velcade. And also we found out that the drug was reasonably well tolerated. The main side effects that we saw was related to fatigue, some drop in the platelet counts, and some GI upset, mostly in the form of nausea, some diarrhea. The good thing was most of the symptoms were well managed with the dose reduction or anti-nausea medications. So we didn't really, we had some patients go off study because of side effects, but majority of the patients who went off study did so because of the disease progression. So there's still 12 out of the 32 patients continuing on study. Some of the patients are only a few cycles into the therapy, so we anticipate that this response rate are going to continue to improve over the next few cycles as these patients continue on study. So we are taking this, the next step forward is another similar study, but using the same patient population, but adding dexamethasone right from the beginning instead of trying to add it later on. So we are exploring 2 different doses of the 9708 in combination with dexamethasone. So that study is currently accruing.